My name is Jordan Bauer. I'm a Radiologic Technologist here at Essentia Health. I work in the General Radiology Department, and I love what I do because we're helping patients, and we get to kind of go to different parts of the hospital. We're not hunkered down in the same areas like an office or like a scanning room or anything like that. So we have this big whiteboard. We have our overnight person writer schedule with all the surgeries we're involved in, so we kind of have an idea of what to expect. Also, we have fluoroscopy studies, which is like live x-rays of like your digestive system. You can also do some work with your spine. Archograms, which they inject dye into your joints and sees the function of it. Then also we work in a pain clinic where they inject steroids into the back for people who have like chronic pain. So like that's all laid out on the board for us, and we have people designated for each area of what we're working in that day. And then other stuff is just kind of like you take it as you go. I got into this, I wanted to be in the medical field. I did not have the patience to go to school to be a doctor. Nursing wasn't really my thing. My dad actually had a friend that works in this field and kind of said, hey, you should look into this. And ever since my sophomore year of high school, I think, I've been dead set on doing it. And there's a few different routes you can take to get there. First step was finding the school that you want to go to. You can either get an associate's degree, it's a 2-year program, or you can get a bachelor's degree in it. And the bachelor's degree is if you're looking to go more into managing. You want to probably go that route, but if you just want to work like on the floor in the field like what we do, a 2-year program is just fine. And I went to Minnesota State Community and Technical College in Detroit Lakes. I was in school for 4 years total, but I had like a semester off in between there. But the X-ray program itself was just 2 years. So part of our schooling, we get shipped to different hospital sites. They're called our clinical rotations. So pretty much it's you're working for free, I guess, for school. You learn a lot. It's pretty much a live job interview is what they tell us to treat it as. Like you're working along with a licensed professional, and you pretty much do the whole exam yourself. If you have any questions, you can always ask. So then it's important when you go there, you have good work ethic, like you have a good attitude, or else you're gonna leave a bad example in that hospital itself. And then, but we go to many places. Like I think I was at 6 total different sites throughout my whole schooling, and it's pretty common for you to get a job at a site of where you're doing your clinicals at. And I was stationed here for a rotation, and I really liked it. I mean, because all the variety that we had, it kept you on your toes. So then I applied for it. I think the Christmas break before I graduated. So like I had a job lined up in January and I didn't graduate till May. So you leave a good example at a site that you like, you're good chance you're gonna get a job there as long as they have openings. Our instructor always said you can teach how to do good x-rays, but you can't teach someone how to be a good person. If you're not a good person, then it's gonna be a little rocky, because obviously it kind of rubs the wrong way with patients, and so you just want to be as kind and considerate as you can with every patient, and just if you're a nice person, I mean, it'll be great. I mean, it's a great job. It's pretty fulfilling too, because the patients are always appreciative of what you do.